Michael here. I am now 6 days on T. I did get my testosterone. I've started taking it, and 6 days, so not a lot of difference just yet. I have noticed that I'm running a little bit easier. As you may know, I've been doing this Couch to 5K program. I'm trying to lose a few pounds, trying to bring my cholesterol down, my triglycerides. By the way, I did get some feedback on my new blood work, and it has gone down significantly, probably mostly because my first blood work was not fasting and it was supposed to be, so my numbers were sky high. Everybody was worried. We did them fasting like they were supposed to be. Still high, not nearly what they were though. So that's good. Did get my tea, working on being healthy, running, trying to lose a few pounds, trying to bring my cholesterol down, my triglycerides, all that stuff. Daughter off to summer camp. She's not coming back until quite a while from now, like 6 weeks. My son is leaving in a couple weeks for summer camp. I'll be free to do whatever I want for a couple of weeks. It's crazy. I've been able to work a little bit thanks to a friend who's been picking up childcare for me. Something that's been on my mind. Started T. My next big step that I want to pursue is top surgery. The process is due to mass health requirements. If I'm not mistaken, I'm still learning this process. Apparently, you need a letter from a quote-unquote gender therapist confirming that you're transgender and that you are in fact ready for this procedure. This bothers me. It bothers me for a number of reasons, and I will outline them. One of the big reasons it bothers me the most, I'm a big believer in therapy. I've actually gone halfway through a master's degree in clinical mental health counseling myself. There is no one on the face of this earth that could not benefit from someone to talk to, as long as it is a good therapist and not an idiot, because there are some out there who are not that great and can do more harm than good. But a good therapist can make anyone all the world of difference. And so I don't have a problem with therapy per se. I do have a problem with the gatekeeping, the waiting lists, the being treated as if being transgender were a mental illness. So according to what I've figured out so far, and I may be wrong, and correct me if any of my things are factually incorrect, but it appears that it's an insurance requirement or a policy as made by the higher-ups with the insurance companies. And as far as I know, every insurance company requires this. So some, I think, even require it in order to go on hormones, which I did not have to get. But I found that the email address for the folks at Mass Health that make policy appears to be hpc-info@state.ma.us, and I have sent them a letter. And some of you may agree with my stance, some of you may disagree, but this is how I feel at any rate. And I've sent them this letter, and if you like this letter, if you agree, please feel free to write a similar letter, write your own letter, write whatever you want. If you would like to contact me, I will email or send to you, or in whatever mode of communication you prefer. I will send you a copy of this letter if you would like it. Just contact me and I will do that. But the letter that I wrote that expresses my feelings is as follows. I wrote, "To whom it may concern. I am writing in regards to the policy that transgender patients must first obtain a letter from a therapist before they can receive gender-confirming surgery. I feel that it is a waste of time, money, and resources, not to mention a major inconvenience in the patient's life. As you may know, the incidence of regret after such a surgery is so statistically small as to be negligible. Furthermore, in many cases, the waiting list to see a therapist can be long. If the mental health field is already overwhelmed with demand, then lifting this requirement will help shorten waiting lists for those those with legitimate mental health issues. Furthermore, being transgendered is no longer a mental illness, so why do you require that therapists treat it? I'm sure you know that while the DSM-4 listed gender identity disorder as a diagnosis, the DSM-5 does not. Just like homosexuality, transgender people are not mentally ill and do not require psychiatric treatment or even diagnosis, since we are perfectly capable of proclaiming our own gender identity, just like those who are gay can proclaim their sexuality without being asked to confirm it with a professional. Another point I would like to discuss is that I am myself currently halfway into a master's degree in clinical mental health counseling, but I have never seen a program or classes offered in quote-unquote gender therapy. I am at this time unclear as to what qualifies a therapist to call themselves a gender therapist, other than a self-proclamation that one is qualified to be a gender therapist. If I am mistaken in this belief, please inform me of the actual requirements. I would just like to close in stating that I have made a number of my life decisions without the aid of any kind of therapist. I have 3 children and was never asked for any confirmation from any kind of professional as to my mental preparedness. I have married and divorced without any queries into whether I should be allowed. I have moved across country, changed jobs, changed careers, and never had my ability to make these changes questioned or subjected to any form of psychiatric gatekeeping. Currently, I am on a waiting list to see a therapist so I can get an approval for top surgery. In the meantime, I have to wear a binder to hide my breasts. It is a hot, tight, heavy compression garment that I wear under my shirt. I cannot exercise or even fully breathe while wearing it, and it rubs my skin raw in places. Many trans men have suffered injuries such as broken ribs and permanent tissue damage caused by wearing this garment. If the damage is severe enough, they may even be told by a surgeon that they are forever ineligible for the double mastectomy that is needed to correct the incongruence between their gender and their bodies. The requirement that transgender people obtain a letter from a therapist before they can obtain gender-confirming therapy is beneficial in no way and has a number of harmful consequences. Since transgender is not a mental illness and does not need to be diagnosed or treated as one, this requirement only serves to further clog an already overwhelmed mental health system and costs money in unnecessary treatment. The number of people who actually regret their surgeries is statistically insignificant, so it does not make sense to make this process unduly burdensome for transgender people who are generally dealing with more than their fair share of stressors already. Sincerely, Michael, blah, 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 etc., etc. So, again, my personal opinion, agree, disagree, you're free to. That's how I feel. That's the letter I sent. If you want a copy of it, let me know. I will send it to you. Thank you very much. See you next time. Bye-bye.